I am currently a urologic oncology fellow at the National Institutes of Health, prostate, bladder, kidney cancer, etc. So, what happens the day before surgery and how do you prepare to come to the hospital for your surgery? Oftentimes, your surgeon will ask you to take what's called a clear liquid diet. And the reason for that is the prostate actually lives in your body very close to the rectum where the stool comes out. And so there's always a theoretical risk as we remove the prostate that there may perchance be an injury to the rectum. This is incredibly rare, but as sort of an insurance policy, many surgeons will ask you to drink a liquid diet similar to how you would prepare for a colonoscopy. And some will add on to that sort of an oral clean out, like the magnesium citrate that you might use, and plus or minus an actual enema through the rectum just to prepare you for that. So that's something that you would face the day before and the morning before surgery. Also, some surgeons will ask you to shower with a certain type of wash to really make sure that your skin is as bacteria free as possible in the morning of the surgery. And something I really want to stress is that what I want to share, I really hope that patients take ownership of what they can control during their hospital experience. And it really does have a big impact on your recovery. So you will have made it through the surgery. We will take care of that. And it's going to take 7 to 10 days for the pathologist to slice and dice the prostate and give you your final results with which we'll base your treatment plan and your next steps. So really want you to focus on what you can do and try to take your mind off of wondering what happened during the surgery and the next steps for your cancer care. So these efforts are really going to make a big difference in your safety and your health. And so what do I mean by that? So there's several exercises that I would like all prostate cancer surgery patients to be able to do. And these exercises, you only need to focus on them while you're awake. While you're sleeping, just get your best rest as you can. And it may be difficult because the nurses will actually have to disturb you every 4 hours to check on your vital signs. And so what you should do when you're approaching these exercises while you're awake is actually space them out for the best effect. Many people will try and go ahead and I'll say, do this 10 times, and they'll do it 10 times quickly, but you really want to space it out so you continue to have the good effect of the exercises over the entire day. So the first exercise that I'd like to introduce is something we call foot flaps. And this is whenever you think of it, just go ahead and do your foot flaps. And what this means is imagine you're pressing the gas pedal on a car and just flap your feet up and down. And the point of this is it helps to prevent a blood clot in your legs so that your calf muscles are moving and the blood that's pooling in your legs isn't just sitting there ready to form a clot, but is circulating back through your body. And we also have some other approaches to prevent blood clots, one of which is what's called a heparin shot, which is a little shot of a little bit of a whiff of a blood thinner. So we're not completely putting you on a therapeutic level of blood thinner, but just a small, we call it prophylactic amount. And you'll get those shots most likely every 8 hours while you're in the hospital. You also have what I like to call squeegee boots, which are some boots that wrap around your ankles and your calves and constantly massage those muscles while you're laying in bed. And some people find them hot and itchy and annoying, but it is really important to keep those on while you're laying in bed. The next exercise that's also very important is actually coughing. And I like to see my patients give 2 big coughs per hour. And the purpose of this is it helps to open and clear the lungs, helps you to get the supplemental oxygen off and get back to how you walked in the door, a normal person that can breathe on room air, and helps to prevent a pneumonia from forming in the lungs. And again, this is something that's really important to space out because it keeps the lungs open for the most time period. A lot of people will avoid this exercise because, as you can imagine, when you cough, it jostles your abdomen where the surgical site was, and that can be uncomfortable and painful. We'll speak more about pain control later. But one thing you can do, a tip and trick, is to take an extra pillow, a bed pillow, and brace yourself on your abdomen so that when you cough, your abdomen is not so jostled. The next exercise is called an incentive spirometer. And this needs to be done 10 times an hour while you're awake. So this will be a little plastic handheld device that has a little straw, and you suck into it. Many people are confused and think they need to try to blow into the device, but you actually suck in to open your lungs to use it. And again, this is the main thing you might think while you're watching TV. You want to do it every time a commercial turns on. You don't just want to stack the 10 at the beginning of the hour. And once you get to be pulling good volumes, because the spirometer goes up to about 2 liters, 2.5 liters, and it'll tell you where you are along that, how much of a breath that you pulled in. Then once you're hitting a good enough number, there's a second device on the side that confuses many people. And the purpose of that is to help you take a slow, even breath. So that's like the pro level. I tell my patients, first get a good number, and then you're taking this home with you to use at home while you recover. The next exercise that is the most important is walking. And I like to see from my patients 4 walks a day. This is the very best thing that you can do to get yourself home and to stay well and avoid complications. And that's because it has many simultaneous effects. You're opening your lungs to prevent a pneumonia. You're moving your legs to prevent a blood clot. And what we'll speak about in detail is that walking helps to wake up your bowels so that food can move through and you can pass gas again. It doesn't matter how many laps you go or how far you go when you walk. It's just important of how many times that you get up during the day. And again, I really want you to space these out. So to speak more about this, this is an image where you can see on the left someone's normal small bowels, and they're working to push through food and gas so that things continue to move forward. And unfortunately, when we do your surgery, when the bowels get exposed to air and our instruments and hands, they get confused. And instead of pushing along like this, they sort of spasm, as you can see on the image of the right, and get swollen and distended with gas. And so that's why you may notice that you feel some bloating and you're not passing gas or stool through your bottom. And the cure for this is walking. Next, talking a little bit about pain control. So your team's goal is going to be for you to be comfortable. So what you can expect to face here is the bloating that I just mentioned and some minor pain, but you don't have to be afraid that you're going to be in extreme or serious pain. That's incredibly rare, and we don't expect or want that to happen. Some patients are well educated and they've heard in the news or in other sources that when you take opiate or narcotic pills, there can be a small risk of habit forming or addiction. And so your average person might come into the hospital and be very afraid to use the oxycodone or the Dilaudid that we ask you to take in your recovery. And it is true that there is a small risk of habit forming or opiate addiction in taking these. So we will try to avoid them, finish using them quickly. If you don't need them, we don't suggest that you take them. But on the flip side, there is a real serious risk of blood clot, slowing down your bowels, and pneumonia if you're just lying there in serious pain that's not addressed. And a lot of times I've come in the room and I've had my patient tell me, just frigid and frozen, and say, Dr. Chalfin, it doesn't hurt so long as I don't move my body. And that's a terrible situation to be in because you're putting yourself at risk for complications. So when you need these pain pills, we highly suggest that you use them. One way to minimize using these is to actually rely on Tylenol around the clock, which means every time, which is usually every 4 to 6 hours that it's due, go ahead and take that, and that will take a serious edge off any pain. And the only caveat for that is if you have a liver issue, your doctor may explain that Tylenol is not good for you. The other things that we have are called Toradol, and then the oral version of that would be sort of an ibuprofen and Advil. These are great anti-inflammatory pain medications, and the only caveats to them is that if you have kidney problems, they may not be so good for you to take if you have abnormal kidney function, and also they can be related to exacerbation of bleeding. So It's great to take Advil and ibuprofen once you're home and your urine is clear yellow and no longer red, and with your doctor's permission, of course. But it's less nice to use those while you're still in the hospital, where we would initially rely on Tylenol. One thing that patients don't realize, you do receive opiates during the course of the surgery while you're under anesthesia anyway. So it's not like an all or nothing thing if you take 1 or 2 pills after the surgery. On the day of surgery, you'll be taken to the preoperative area, and this is where you'll say goodbye to your family and meet with the surgeon and the anesthesia team and sign your consent forms if you haven't already done that. And for you, you'll have a good rest and a good nap while we do our work. And the next thing that you'll know, it'll be the afternoon or evening after surgery. And you'll initially recover in the recovery room and then be transferred to a regular floor. So my goals for you at this point would be, if you can give me just 1 walk this afternoon or evening, that would be A+, fantastic. Now, I certainly understand that sometimes patients are too sleepy or tired or in pain and discomfort, and they can't make that first walk the night of surgery. And then I would advise them just to really focus on an early morning walk the next morning. But if you can, that's a really fabulous sign of your recovery. Of course, your walk has to be with your nurse. You'll have many new tubes and lines, and you don't want to feel faint without anyone there. So it has to be with your nurse until they give you permission to go alone. And then the other thing I'm looking for the night of surgery, when I come to check you the next morning, is that, have you been able to stop using supplemental oxygen and gone on to breathing room air like how you did when you came in? That's a sign that you're on the right track and you're doing your exercises properly. So again, those exercises to focus on. You may notice you have a sore throat. That's expected. That's going to be minimal. That could be from the tube that was in place, your breathing tube during anesthesia. Another interesting thing to point out is that there's this phenomenon. This only applies to robotic surgery, not open surgery. But during robotic surgery, we fill the abdomen with carbon dioxide gas, and that causes an irritation of the diaphragm, which is the muscle that underlies the lungs and helps them to open and breathe. And for some reason, the wiring of the nervous system translates irritation of that nerve to the shoulders. And so a lot of patients will experience a brief shoulder pain. Again, not anything severe or debilitating, but something that could be surprising. And that actually may be more noticeable or worse when you get up to rise, and we would expect it to get better and go away over the next several days. And that night or afternoon after surgery, you will more than likely be on what's called the clear liquid diet again. Don't worry, you won't feel hungry at this point, having gone through the surgery, and you'll have some ice chips, Jello, and broth for that evening. Then what about the first day after surgery that we call post-operative day 1? So again, the bloating is something you're going to feel, and it can actually be normal to take up to a week to pass gas or have a bowel movement after surgery. So what you should again focus on are your exercises. Eat breakfast, and I'll talk more about what foods to eat. You'll probably be receiving some training on your urine catheter, and we'll talk more about that coming up. And you may be getting some discharge teaching to prepare you to go home from nurses, and there may be a set video that the institution has for you to watch. I really would like you to consider using a suppository on this day. This is a small medicine that goes into the rectum. What I tell my patients is, this is certainly not required, because it is expected that you won't have a bowel movement or pass gas for up to a week. But what this can do is help speed things along, and it can help relieve some of the gas in the rectum when the nurse places the suppository. So if you find that you're really tortured by the bloating feeling, you may want to consider using that suppository while you're in the hospital the first day. And then, of course, if you have a drain, a surgical drain, that will likely be removed before you go home. And so I want to say some more about a drain. So whether or not you have a drain after a prostatectomy probably has more to do with your surgeon than you or how your surgery went. There's a new trend towards not leaving a drain during prostatectomy. But in many cases, or a more conservative person, they will choose to leave the drain. The purpose of the drain is to see if there is urine that is leaking from where the bladder has been sewn back to the urethra, and to leave that drain in place so that can heal over the catheter before the drain is removed. When the drain is actually removed, people tell me, because I ask my patients for their experience, that it simply just feels weird when it comes out for 3 or 5 seconds versus any severe or debilitating pain. So it's not something to be afraid of, just to know that you'll have a brief, strange sensation. While you have the drain in and after it's removed, you can notice some leaking of some thin fluid, either red or yellow, around the site that will heal in the coming days. Some doctors will be checking the drain fluid with a lab work to see if it does contain urine, and that's called a creatinine check. Other doctors may rely on the amount of fluid that's coming out. And if you do end up having a leak of urine, you might be sent home with the drain and be asked to keep a diary of how much is coming out over time. But ultimately, we would expect that all drains would come out. So what about you being discharged? What are the doctors looking for? So overwhelmingly, patients after prostatectomy are discharged on the first day. We are looking for you to meet certain benchmarks for that to be safe. And that is if you can eat without feeling nauseous, without vomiting, if you can get up and walk without fainting or feeling dizzy, if you've managed to no longer need supplemental oxygen and can breathe with room air, and that your vital signs are normal. Very importantly, we look at the catheter and check how much urine you're making and the color of the urine. Is it yellow, pink, or red? We check your blood work, including your infection number, your blood number, and your kidney function. And again, you don't necessarily need to pass gas for you to be sent home, because we expect that over the coming week. So what do you do if you've gone home and you're not even passing gas yet? What are you supposed to eat? So the morning after surgery, I highly recommend that you start off with a cream of wheat or an oatmeal, and that's what's called a full liquid diet for breakfast. And your doctor may keep you on that for lunch with a potato soup or a tomato soup or something like that, or they may transition you to a regular diet. But I really try to impress to my patients that when you're on a regular diet, I really want you to think of it as a common sense diet, because if nothing's coming out in terms of bowel movement or passing gas, you really don't want to continue to eat heavy or spicy foods. So I asked them to imagine, as if you had the stomach flu, a stomach bug, what types of things you would eat on a sensitive stomach, like crackers, stews, plain rice, even chicken is okay, but it's not the time for, you know, a T-bone steak or maybe any type of spicy food. So just really use common sense as you move forward during that time period. Again, even when you go home, I still want you to continue the 4 walks per day. And while you have the catheter in, which is typically for 7 to 10 days after the surgery, I'd like you to keep the walks inside your home and to a flat surface. And that's just so we avoid disturbing or yanking on the catheter. If you have stairs in your home, I really ask that you make your day on one level. So if you sleep upstairs, kind of come downstairs in the morning, make your day on the main level, and then go back up and sleep. And again, that's to not disturb the catheter. When you're resting, it's also very important to avoid, until the catheter comes out, sitting at 90 degrees. So this is the one opportunity that you'd want to be like the gentleman on the right here and kind of leaning back in a recliner chair, as opposed to sitting 90 degrees up. Laying perfectly flat in bed is good, but it's not ideal to be sleeping on your side or curled up. You really want to sleep flat on your back and be sitting at a recline or standing straight up and walking around. So what are you going to do with this catheter? Because by the time you go home, you don't have any IVs anymore, and you really simply just have this catheter. So I like my patients to focus on one rule, and that is the catheter completely blocked? Because that would be the rare emergency. And in fact, that's the only thing you really have to worry about with the catheter. So how do you know if it's blocked or not? The good news is it can't be partly blocked. It's really either it's blocked or it's not. So what I would ask you to do if you have a concern is fully empty the urine bag, as you'll be trained to do, and then wait 1 or 2 hours and watch to see if the bag is refilling. So long as the bag is refilling, you can be assured that it's not blocked. And the reason why I point out this rule of thumb is because there are several other things that can happen with the catheter that are okay, that are not perfectly intuitive. And one example is that you can actually leak urine from the tip of the penis around the catheter, and that's perfectly normal. That can be from a little spasm you may have due to irritation from the catheter balloon, or especially when you're bearing down to have that first bowel movement at home, you certainly may notice that urine is leaking around the catheter. And again, that's okay if the catheter is not blocked. You may also notice a tinge of blood or drop of blood around the catheter at the tip of the penis. What we're looking for in terms of urine color is that the redness or pinkness quality of the urine is improving back to yellow over time and not worsening and becoming more bloody. If that were to happen, you should contact your doctor. And final thing I'll say about the catheter is that there's something called a leg bag, which is a smaller bag that can attach to your leg and is much smaller than the large bag that we like you to wear at nighttime, because you're not getting up and going to the bathroom, and we don't want any back pressure to form. If you just have the small leg bag on, it can fill up and have no more space for the urine to come out. And so many people do like to switch between the small leg bag to be about during the day and the large bag for at night. And we are very careful to ask you to wash the connector pieces with alcohol swabs when you do that. But my personal preference, if you can manage this with your own situation, is I would just ask that you keep the one big bag on while you're recovering until the catheter comes out, if you can manage that, because that minimizes any risk of back pressure on the kidneys. There's no chance for infection to get in when you're disconnecting and reconnecting the catheter. But there are some people that have a certain job or certain obligations, and so they have to use the leg bag, and that's okay too. And finally, when you come to get your catheter removed, you'll have been asked to take an antibiotic in advance to prepare for that. So other concerns that might come up when you first go home and when to call. So just follow the catheter rule of thumb. Is it totally blocked? You certainly need to call. The other concerns that would come up, I want to reassure you that I feel they would be common sense and you would know if there was an issue, such as if you develop a fever, vomiting, severe pain, bleeding or pus at the incision sites, or if you go beyond that week and you still haven't had a bowel movement or gas from your bottom, then those would be reasons to call. But those seem to be much more obvious than dealing with the catheter. And for the catheter, as long as it's draining, you're in good shape. You have incisions that may be stapled or they may be glued. And so how do you take a shower? In general, once you go home, we allow you to shower, but we really ask that you let the water fall onto your back and not sort of angle the shower head onto these incisions that you would have. It's very important not to do any type of soaking in the pool or hot tub until, people will tell you different lengths, 4, 6, 8 weeks after surgery. And finally, no heavy lifting again for that same time frame. So that's what I was hoping to cover. I sort of laid out, for those that might be more anxious and really want to know exactly what to expect, all the things that might happen. But I think it's really important to realize that most people are sort of flying through their experience. They come and have their surgery and they go home the next morning, and a very smooth process. I think it would be fabulous to bring your own robe, your own slippers, your own pillow, if that makes you more comfortable, your own pillowcase. I think all of those options are possible. And please bring your own blanket, especially if you get cold, because the hospital blankets are not very warm. We can give you additional ones, but I think that's a key piece of comfort, that many patients bring their own blanket and really enjoy that experience.